Hello, I'm Dr. Ramin Fathi, a dermatologist and Mohs surgeon at Phoenix Surgical Dermatology Group. Today I'd like to talk to you about the informed consent process and answer some frequently asked questions about Mohs micrographic surgery. This procedure is highly effective for treating certain types of skin cancer, and I want to ensure you feel confident and informed about your upcoming surgery. Let's start with what Mohs micrographic surgery is. This specialized surgical technique is used to treat skin cancer by removing the cancerous tissue layer by layer while preserving as much healthy tissue as possible. It's particularly useful for cancers located in cosmetically sensitive areas like the face, ears, and neck, as well as recurrent or aggressive tumors. Now let's go through the informed consent process. Informed consent means that you understand the nature of the procedure, its risks and benefits, and alternative treatment options. It's crucial that you have all the necessary information and make an educated decision about your treatment. Here are the key points we'll cover. First, the purpose of the procedure. Mohs micrographic surgery aims to remove all cancerous cells while sparing as much healthy tissue as possible. It's known for its high cure rates and precision. Second, the procedure details. The surgery is performed under local anesthesia. The affected area is numbed and a thin layer of tissue is removed and examined under a microscope. This process is repeated until no cancer cells are detected. Third, the duration and expectations. The procedure can take several hours as each layer is carefully analyzed, so you should plan to spend most of the day at our office. Number 4, the risks and complications. Common risks include bleeding, infection, and scarring. There's a higher risk of nerve damage in areas such as the temple, the jawline, and the neck. This could lead potentially to temporary or permanent changes in sensation or movement. Fortunately, this is very rare. Rare complications may include allergic reactions to the anesthesia as well. Benefits. Number 5. The benefits include a high cure rate, especially for basal cell carcinoma and squamous cell carcinoma. It also benefits you because there's minimal removal of healthy tissue resulting in smaller scars. 6. Alternatives to treatment. There are several alternatives. There's one that's called traditional excisional surgery. This involves removing the tumor along with a margin of healthy tissue. It is less precise than Mohs surgery and can result in larger scars. Radiation therapy is another option for treatment. This uses high energy rays to kill cancer cells. While it can be effective, it often requires multiple sessions over several weeks and may not be suitable for all types of skin cancer. It can also cause skin irritation and other side effects such as more skin cancer. Electrodesiccation and curettage, also known as ED&C, is a method that involves scraping away the tumor and using an electric needle to destroy any remaining cancer cells. It's generally used only for small, superficial skin cancers and has a high recurrence rate compared to Mohs surgery. Typically, this is not done on cosmetically sensitive areas. Finally, topical medications such as creams or gels can be applied to the skin, but these are also used for superficial cancers. They are less effective for invasive or aggressive tumors and often require a long treatment duration. So why is Mohs superior? Well, because it offers the highest cure rate, particularly for difficult to treat areas and recurrent tumors. It allows for immediate microscopic examination of the tissue, ensuring complete cancer removal while sparing healthy tissue. The precision of Mohs surgery reduces the likelihood of needing additional treatments and minimizes scarring, which is especially important for cosmetically sensitive areas. Number 7, post-operative care. Instructions for wound care and signs of complication will be provided to you. Follow-up appointments to monitor healing and ensure no recurrence will also be part of the procedure. 8. Activity limitations post-operatively. After surgery, it's important to limit physical activity to allow proper healing. Avoid strenuous activities, heavy lifting, and exercise for at least 1 to 2 weeks or as advised. Keep the surgical site clean and dry and follow all wound care instructions carefully to prevent infection and promote healing. Now let's address some frequently asked questions. One question that we get is, will the procedure be painful? Well, most patients experience minimal discomfort during the procedure due to the local anesthesia. You may feel some pressure, but it shouldn't be painful. After the anesthesia wears off, you may experience some mild pain or discomfort, which can be typically managed with over-the-counter pain medications. Another question we get is, how long will it take to heal? Well, healing times vary depending on the size and location of the treated area. Generally, the initial healing phase takes about 1 to 2 weeks, with complete healing taking several months. We'll provide detailed instructions on how to care for your wound to promote optimal healing. Third question is, will there be a scar? Well, any surgical procedure will result in some scarring. However, because Mohs surgery removes only the cancerous tissue and preserves as much healthy tissue as possible, the resulting scar is typically smaller compared to other surgical methods. We'll discuss reconstruction options if needed to ensure the best cosmetic outcome. Question 4. What should I do to prepare for the surgery? We'll provide specific instructions before your surgery, but generally you should continue taking your regular medications unless advised otherwise. If you're prescribed blood thinning medications by another physician, we do not stop those for Mohs surgery. But in general, you should avoid other blood thinning supplements such as aspirin and vitamin E a few days before the surgery unless directed otherwise. You can eat and drink as usual on the day of your surgery. However, if you're having the reconstruction portion of the procedure done at another office on the same day, please follow that office's specific guidelines on eating and drinking. Question 5. How effective is Mohs surgery? Mohs surgery has a very high cure rate, around 99% for primary basal cell carcinomas and 97% for primary squamous cell carcinomas. For recurrent cancers, the cure rate is slightly lower but still very high compared to other treatment methods. I hope this video has provided you with a comprehensive understanding of the informed consent process and answered some of your questions about Mohs micrographic surgery. If you have any more questions or concerns, please don't hesitate to contact our office. We're here to support you every step of the way. Thank you for watching, and we look forward to providing you with the highest level of care. Remember, your health and well-being are our top priorities.